How do I understand colon pathology, immunohistochemistry results? Imagine opening a detailed report after a colon biopsy and feeling a bit overwhelmed. What do all those stains and symbols really mean? Understanding immunohistochemistry results in colon pathology can seem complex, but it's really about reading patterns that tell us about the nature of the tissue. These results help doctors determine if a lesion is benign or malignant, and they can even provide clues about genetic conditions like Lynch syndrome. In colon pathology, immunohistochemistry uses special antibodies to detect specific proteins within tissue samples. When a tissue is stained, the presence or absence of color in certain areas indicates whether those proteins are being produced by the cells. For example, if a tumor cell shows strong nuclear staining for mismatch repair proteins, it suggests those proteins are functioning normally. Conversely, if the staining is absent in tumor cells but present in surrounding normal tissue, it points to a loss of that protein, which can be significant for diagnosis and treatment planning. The most important markers in colon cancer testing are the mismatch repair proteins, which include MLH1, MSH2, MSH6, and PMS2. These proteins help repair DNA errors. When they are missing, it can lead to microsatellite instability, a condition linked to Lynch syndrome, a hereditary cancer risk. Normal colon tissue and most tumors will show positive nuclear staining for these proteins. If a tumor lacks staining for one or more of these proteins, it suggests that the DNA repair process might be defective, which can influence treatment options and genetic counseling. Interpreting the staining pattern is straightforward once you understand the basics. Positive staining means the protein is present and the cells show color in the nucleus or cytoplasm, depending on the marker. Loss of staining means the protein is absent in tumor cells, even though the internal controls, normal cells in the same sample, still stain positively. This internal control is crucial because it confirms the test worked correctly. If neither tumor nor normal cells stain, the result might be unreliable and needs reevaluation. Pathologists often use scoring systems to quantify how much of the tissue is stained and how intense the staining appears. They might use a system that multiplies the percentage of positive cells by the staining intensity, giving a score that helps classify the result as negative, weak, moderate, or strong. These scores help guide clinical decisions, especially when considering genetic syndromes or targeted therapies. In practice, immunohistochemistry testing for mismatch repair proteins is now standard for all colorectal cancers. This helps identify patients who might have Lynch syndrome, which is important for their own health and for family members. When reviewing results, the pathologist looks at the pattern of staining, checks the internal controls, and considers the clinical context. If the tumor shows loss of a protein, it might mean the gene responsible is mutated or silenced, which can have implications for prognosis and treatment. However, interpretation isn't always perfect. Sometimes staining can be heterogeneous, meaning some areas of the tumor stain differently. Faint or patchy staining may requiring additional testing or repeat biopsies. It's also essential to combine these results with other histological features and clinical information for a complete picture. Your healthcare team will review the report carefully and discuss what it means for your diagnosis and treatment options. Remember, understanding these results is about recognizing patterns and knowing that they are pieces of a larger puzzle. Always consult with your doctor or a specialist who can explain what the findings mean specifically for you. They can help interpret the results in the context of your overall health, family history, and treatment plan. Immunohistochemistry results are powerful tools that, when understood correctly, can guide personalized care and improve outcomes.